Colleagues, thank you for attending. This is a special meeting of the Health Services Panel. This is mainly a public hearing on the regulation of private healthcare facilities. Please invite the deputations and officials to come in. Welcome, Secretary for Food and Health and deputations. This is a public hearing to discuss the regulation of private healthcare facilities. So we'll discuss the consultation document on regulation of private healthcare facilities. Dr. Co-Secretary for Food and Health, do you have anything to say to members before the deputations speak? If not, we'll wait for the deputations to be seated. Theoretically, this meeting should end at 12:30 p.m. So we have a 3-hour meeting. Depending on the discussion with the deputations, we may take a 5-minute break at 11:30 a.m. for you to say, have a drink. Welcome, deputations. Today we have 27 deputations. They're interested in the consultation document on regulation of private healthcare facilities, so they'll express their views. We have the Bureau Director, our own members, and the deputations. I'd like to remind you, the deputations, that your remarks will not be protected by the Electoral Powers and Privileges Ordinance. In front of you are a number of buttons. You can choose the channel you want. Channel 0 Floor, Channel 1 Cantonese, Channel 2 English, and Channel 3 Putonghua. The rule today is that I'll give each of you 3 minutes to speak. I'll stop you at 3 minutes. And 3 deputations would like to leave early and would like to speak first. In the past, we compiled the order of speaking in accordance with the time of registration. So number 14, number 23, and number 25 would like to speak first. So if members have no special comment, I can allow them to speak first, and then they can leave afterwards. And then supplementary information can be submitted to the Bureau Director later. So 3 minutes each. First of all, Dr. Yang Chiu-Fat, President of Hong Kong Doctors Union. Thank you, Mr. Chairman. We have thousands of doctors in our union. We would like to present a number of views for your consideration. For example, the high-risk procedures, we're of the view that some shouldn't be high-risk procedures, and some in the high-risk procedures list should actually Some in the low-risk procedures list should belong to the high-risk procedures list. So you should frequently review the degree of risks involved, because for the medical sector, science and technology are ever advancing. So today, when something is of high risk, in future it may become low risk. For example, in your consultation document, prostrate and urination system come under the low-risk list, but in fact they're high-risk in nature. For example, kidney inspection may involve high risk. For example, uterus biopsy examination should come under the high-risk list. Hair transplant and implant into the skin can come under the low-risk list. As for the regulation of private hospitals, the consultation document has put forth very good comments and recommendations. The electronic medical record system, well, it said that private hospitals should join. We're of the view that you should obtain 100% patient's consent first. As for the regulation of private hospitals, the document says that in future, private hospitals have to adopt a high degree of transparency for fees and charges and other items to protect the public. Starting from 2011, private doctors are required to take out a very strange insurance, that is unlimited medical liability. However, for this unlimited liability, it's very strange that is provided by a UK company, which is a private limited company. So we're thinking of the logic. A limited company providing unlimited protection. That's rather strange. A patient would like to have a doctor he prefers to join hands with him to struggle against diseases. So please take note of that. Next, Dr. Zhe, the immediate past president of the Hong Kong Medical Association, Dr. Zhe Hongheng. I have to declare, Mr. Chairman, that I'm a member of the steering committee. As a responsible provider of medical and healthcare services, regulation is absolutely necessary.
The purpose of regulation is to protect, to safeguard the health and safety of the people and to ensure their rights. That's the sole objective of legislating for regulation. It is not to protect the survival of certain trades. The sole objective should be to protect the citizens. If some industries make mistakes, if some industries do things irresponsibly, they only have themselves to blame. As for regulation, there should be no loopholes. We support regulation. However, in this consultation document, we find a major loophole because your goal is to regulate private healthcare facilities. And for private healthcare facilities, they provide medical services, and they are private. It's very easy to define what is meant by private in the law. Facilities is also a term that can be defined easily. However, what is healthcare services? What is medical services? What kind of behaviors or acts will be covered is not stated in any piece of legislation. If you are going to legislate for this, then for responsible healthcare providers like us, we have no problem with it because every day we provide healthcare services. Institutions have to be regulated. I support that 100%. However, for some people, if they have ill intention, they can say that they are not providing healthcare services. That's why they should not subject to such regulations. How can you do that? So if the law is not clear, then you have to go to a court. The government would issue guidelines and they would only serve as guides for those who are involved, and it would not govern the courts. So as to where an act is a medical procedure, that is subject to the interpretation of the judge. And this is the greatest problem about this consultation document. At the steering committee, I already pointed this out. As to whether the government accepts it, and specifically whether the secretary accepts it, is up to the decision of the secretary. Now, today, I have to go back to my clinic because it's near the Chinese New Year, so I have to go now. And thank you for giving me this opportunity. Thank you. Next, Hong Kong Stem Cell Center, Dr. Joseph Wang. I would like to talk about the regulation of stem cell. Well, for taking out the stem cell, and for clinical application of stem cell, I would like to say something about that. First of all, we have to do some liposuction, or we have to do some marrow puncture. We will take the stem cell out, and then it will be processed in a laboratory. Now, this step has to be regulated. In the laboratory, there should be a head. He can be a doctor, and he should monitor the work of the laboratory. And in the laboratory, all the people should have been professionally trained. For example, they should know whether the stem cell is polluted or contaminated. This point is very important. And then I would like to talk about the clinical application of stem cell. Many medical literature has shown us that for the injection of stem cell, for example, injecting into joints and muscles, etc., the procedure is actually very safe. As long as the stem cell is not contaminated, as long as it's prepared properly, then injection of stem cell will not cause any complications. For your documents, you say that for any cell injection, that's on page 104, you say that it should be subject to regulation. So in the near future, I think this should really be relaxed. Now, when should stem cells be regulated? Now, if it is related to high-risk medical procedure, then you may consider that. For example, when it comes to the injection of stem cells, sometimes you may have to open the brain and inject the stem cell into the brain. So this would be a high-risk procedure. And sometimes you may inject stem cell into the heart, and this is risky. And sometimes you may inject the stem cells into the artery using catheter, and then you may touch some major organs. That would also be risky. So I call on the government to look at this risky procedures. For example, lymphopuncture, etc. This is risky. However, if it's just injecting into the muscle or the veins, then the risk is very low. Thank you. Now let us go back to our original order. The first speaker should be Mr. Joseph Ho from the Cosmetic and Perfumery Association of Hong Kong. Good morning, everyone. We were established in 1980, and we have a history of 35 years. Now, our goal is to serve the industry and the consumers. We also hope that we can form a communication platform for the industry and the consumers. In October 2012, that we had seen the DL incident, which has raised significant concern, and the Food and Health Bureau, as well as Dr. Koh, has designated the issue as a medical incident. There were a lot of reports on the incident, and it gave the public a wrong message. The consumers were quite confused, and the beauty service providers like us really don't know what to do. And there are some black sheep in the industry that are bringing about this negative impacts on our industry, and it also affects young people. Some young people originally they wanted to join the beauty industry. However, they now think this is not such a good industry. So this has dealt a heavy blow on our industry. Over the past few years, the government has been advocating professionalism, has implemented the qualification framework, and it hopes that levels in our profession can be enhanced. However, he has never put forward any long-term plan for the development of our industry. We hope that we can have a good industry which can compete with the relevant industries in our neighboring countries and cities. However, the government has never responded to us. With regards to this consultation document on regulation of private healthcare facilities, we actually support it because it has focused on some core issues. In particular, Chapter 6 is about institutional standards. B6, premises management, B7, environments and facilities, B6, infection control, etc. This would serve for the reduction of risks in our industry. However, our industry still have some queries and suggestions. First of all, about the appointment of a responsible person or a licensee, we don't think that this should be confined to certain professionals. And the premises should be used in an efficient manner. We think that the government should adopt a broader definition because we just want to identify a person that would hold the responsibility. Second, assessment of high-risk medical procedure. Now, there have been a lot of high-risk medical procedures in recent years. They are being classified as high-risk. However, I hope that this can be relaxed a bit. And also for the regulation of instruments and tools, I think many of them should not be defined as high-risk products. Well, when it comes to risk, training is very important, and as we advance forward, there will be a lot of changes. So I hope that more guidelines can be provided by the government. Sorry for interrupting you, but your time is up. Second, Hong Kong Academy of Medicine, Professor Lau Chek Sing. Thank you, Chairman. The Hong Kong Academy of Medicine is a statutory body, and we provide training to medical and dental professionals. We to ensure the safety of the public. We agree that the government should introduce a regulatory regime for private healthcare facilities. As for high-risk medical procedures, I have the following views. First of all, high-risk medical procedures must be performed in recognized places with proper facilities. And the professionals performing high-risk medical procedures should have received the relevant training and accreditation. As for the consultation document, our Academy of Medicine and the colleges under our organization will be presenting the views to the LegCo. Now, here are our views. First of all, about the scope of regulation. The Hong Kong Academy of Medicine thinks that other than hospitals and ambulatory centers and facilities providing medical services under the management of incorporated bodies, we think that private medical laboratories should also be regulated. This is different from the practices in other advanced countries, and we think this is not acceptable. As for the second area, I would like to talk about a regulatory framework. we have three major directions here. First of all is about facilities and clinical quality, and we want to make 6 points here. First of all, when it comes to a regulation, we think that the facilities and objectives should be feasible, but the most important thing is the safety of patients. And the standards and criteria must be balanced, and they should be able to gain the trust of the public. And secondly, we think that we can take reference from overseas practices, but they should be localized. And thirdly, when it comes to details, we think that the professional experts should be setting out the details. Our academy is very willing to help. And fourthly, for non-hospital private facilities, we think that they should be regulated. First, when it comes to clinical investigation and sentinel events, I think we should attach more importance to them, and proper reports must be made when such things happen. We want to ensure quality. So when a medical incident happens, there must be proper reports. And we must look at the latest technology when it comes to regulation. And I still have 2 quick points. When it comes to the transparency of fees and charges, we think this is very important. However, we understand that sometimes for complicated and urgent procedures, sometimes it's very difficult to give you an accurate estimation of charges. We hope that the regulation can be conducted from a macroscopic perspective. Next, Hong Kong Hair and Beauty Merchants Association, Ms. Maggie Leung. My name is Maggie Leung. I am the Vice President of the Hong Kong Hair and Beauty Merchants Association. We were established in 2005. We cover several areas: hair, beauty, facial beauty, pedicures, etc. We support the government's proposed regulation of private healthcare facilities because we are also members of the public. And we also agree with Mr. Ho.
In 2012, when the DR incident occurred, the beauty services industry was affected by a spate of medical incidents and had been severely criticized. In fact, we're rather innocent and aggrieved. In fact, there are 3 major categories covering 19 regulatory items. Well, I think those are clear recommendations. Given the demand of modern societies internationally, there is a huge demand for healthcare and medical services. And sometimes the line between treatment of diseases and beauty services may be blurred. Sometimes certain practices had been used to slow down aging. In fact, beauty services have become a very major economic sector. Yes, it's of course very good that all members of our sector abide by the law. Now, we agree that there should be a high degree of transparency for the fee structure. But as operators, we won't like to step into any trap. So, while providing the public with transparent and clear guidelines, operators of our sector would like to have clear definition about high-risk and low-risk procedures as well as clear guidelines. We'd also like to receive frequent updating of these guidelines. We would not like to have to look up ourselves the updates, so we would like the Department of Health to provide us with updates frequently. Let me remind the deputations and individuals attending that if you have any written comments, you can submit them to us after the meeting. Next, Ms. Kwok from Democratic Alliance for the Betterment and Progress of Hong Kong. I'm the Deputy Spokesman of Health Services for DAB, Mr. Chairman. I'd like to present 3 views on this consultation document. As science and technology advance, the line is now more and more blurred. Apart from medical and treatment procedures. There are also procedures to improve physical health and the appearance of a person. And sometimes risks in procedures are involved, like surgery and anesthetics. All these should be applied by professionals. The premises and equipment used must be safe. However, the related laws had not been updated since 1966 in accordance with the actual circumstances in society and in accordance with the development of medical bodies. Therefore, it is a major trend to have a consultation exercise. And in recent years, there had been fatal incidents involving high-risk healthcare procedures. So between medical and healthcare services and beauty services, there are a lot of gray areas. If suitable amendments can be made to our laws to appropriately clarify definitions and functions, plus proper regulation to map out the roles of all the stakeholders, then there would be better protection for the industries and members of the public. There had been auditing for private hospitals in recent years, and there were also concerns about the transparency of the financial position and fee structure of private hospitals. In fact, the power of inspection and regulation on private hospitals is rather limited, and even fines have not proved to be deterrent enough. As Mr. Chen Han-pan, our electrical member, said, the role of the private sector in medical and healthcare services is becoming more and more important. If we can make adjustments to enhance regulation of the private sector, enhance protection for the public, as well as enhance the overall standard of service of the sector, it would be very good, and we would like you to proceed with that direction as soon as possible. Thank you. Next, Dr. Kwok from Association of Private Medical Specialists of Hong Kong. Thank you, Mr. Chairman. Today I'm representing the Association of Private Medical Specialists of Hong Kong. First of all, I have to declare that I'm a member of one of the steering committees. For private medical specialists, they of course are important stakeholders in the whole medical and healthcare system. Therefore, we welcome the proposed regulation or mode of regulation. In the consultation document, private hospitals, facilities conducting high-risk procedures, and statutory bodies providing medical and healthcare services are the three major targets of regulation. We support that, and the government should proceed as soon as possible. I'd like to raise a number of concerns here. For high-risk procedures, as many speakers said just now, in the past, incidents had occurred, particularly involving procedures carried out by the beauty services industry. It is necessary for us to separate medical procedures and beauty services procedures. I agree to the items recommended in the consultation document. However, those items may have to be changed in future. For example, high-risk procedures may become low-risk in procedures in future, and experts and professionals should have a say here. So there must be experts and professionals to monitor the situation on a standing basis. We don't think non-professionals or non-experts should do the job. Intrusive procedures, for example, should put under the high-risk list. As for the transparency of fees and charges, we agree that we should enhance transparency. In the table published here, for doctors to fill out the fees and charges, I think doctors should only fill out those parts related to doctors. They shouldn't represent hospitals in terms of assessment. And assessment should remain assessment, because if the final fees and charges are different, the government should explain clearly to members of the public, because sometimes we don't know unforeseeable elements. As for packages, they only suit medical items that are appropriate, because doctors should have the right to keep the initiative. Otherwise, doctors' hands will be tied and irresponsible activities may occur. Next, Ms. Kelly Wong.
For the Hong Kong people or for your political agenda? It makes very little economic sense. I'll mention that first. It is currently, Hong Kong has currently the second most expensive healthcare plan in the world, and right after the Americans, who are now the largest economy but also going bankrupt because of their commitment to the bottomless pit of healthcare budget. In 1963, Lyndon Johnson had declared an unconditional war on poverty. And now what do we have? We have healthcare spending in the U.S. that has increased 12 times, and also families who don't work for 3 generations because they earn more taking checks than working and paying taxes. So back to the medical plan. Currently, the Hong Kong's coroner's court takes care of medical malpractice and should have no problem to continue doing so. And a government takeover would be breaching the basic law, may I remind you, following in the footsteps of our friends up north. And I'm sure we're familiar with the standards of that system. In terms of increased regulation, that can only restrict medical supply, and in this case would be the good doctors, first supply of doctors. So eventually only the rich can go abroad and afford to go abroad and receive the right treatment by the right doctor. And this would be the only group in Hong Kong that can reap the benefits of the voluntary healthcare insurance in the future, only in time. So I think I'd suggest to think harder before entertaining this proposal. And considering that Hong Kong people live longest on earth currently, beating Japan, I don't think we need increased facility regulation. What we do need is a continued fresh supply of doctors to rescue the short-handed medical system, and that hopefully Hong Kong people can entrust their health and lives to their own medical system again soon. So I ask you again, is politics more important than the lives of our people? Thank you, Chairman.
Thank you. 跟住咧就係養和醫院嘅翁醫生。
主席，多謝。
Next, Hong Kong Sanatorium and Hospital, Dr. Raymond Yung. Mr. Chairman, all these years, Hong Kong Sanatorium aims at providing high quality and timely medical services to the public. So we very much support the recommendations in the consultation document, particularly the major direction. And we have a number of views for the government to consider. First of all, the scope of regulation. We know that at the moment it will cover hospitals as well as intrusive procedures adopted by certain bodies, as well as such procedures carried out by statutory bodies. We know that statutory bodies are licensees, but sometimes they may be a group. Sometimes they may not be a group, but they're already adopting group practices. So it's worthwhile to reconsider whether or not they should be covered. And the document has not covered certain statutory bodies like clinical audit, risk management. They're not yet covered by the recommendations. But these institutions are also carrying out diversified medical and healthcare services. So for risk management and auditing, such bodies should also be included. And then credentialing, that is accreditation. For the moment, accreditation only applies to hospital services. For these medical institutions or institutions carrying out intrusive procedures, all those providing such services should go through a credentialing process. So we would like the scope to be broadened. And credentialing shouldn't just be confined to doctors, but also providers of professional services. For example, those in hospitals. There should be credentialing procedures to assess whether or not these people are carrying out their duties professionally. And then for confidentiality, when we are investigating into certain incidents, the document proposes that the particulars should be kept confidential. We absolutely support that recommendation because this will allow us to carry out in-depth investigation. And when our colleagues know that materials will be kept confidential, we'll feel free to carry out in-depth investigation. And from that, we can learn lessons that we should learn. And then for accreditation, it is proposed that all licensed hospitals should undergo accreditation. But we're of the view that at the upstream, for X-ray, laboratory work, etc., they should also come under an accreditation system. Thank you. Next, Kwintong District Councillor, Mr. Ngan.
Oh, he's not here. Then let's ask the next one to speak. Ms. Amy Hui, Hong Kong Beauty and Fitness Professionals General Union. Good morning, everyone. We welcome the government's proposal. We hope the government will start regulating high-risk medical procedures as soon as possible. However, the government must distinguish very clearly the definitions of high-risk medical procedures and beauty services. Now, can the regulatory regime of the government solve all the problems concerning medical services under the management of incorporated bodies or doctors? The law has to be clear. Otherwise, when things happen, there may still be disputes over responsibilities. Now, the government is conducting a consultation on the regulation of private healthcare facilities. We understand that they are not targeting the beauty industry. They are just targeting high-risk medical procedures. However, there have been rumors saying that the government will be very stringent, and beauty services providers like us will have to be licensed, and we will have to take examinations, etc. The government has said that, well, for high-risk medical procedures that are to be carried out by doctors, they should be carried out by professionals. So I think we have to be very careful. We hope that people will not reap profits out of the loopholes. And I also hope that the government will explain about the rumors so that our industry can be reassured when we work. Now, we hope that the government would regulate high-risk medical procedures in ambulatory setting as soon as possible. The relevant facilities, equipments, and venues should be regulated. And also the relevant doctors' qualifications should also be regulated so as to ensure the safety of consumers. And for ambulatory facilities, there should be a complaint system. So if there are any complaints, there is a mechanism to handle them. And for regulating high-risk medical procedures and equipment, our industry and the public should be consulted thoroughly. Otherwise, our frontline workers may be accidentally caught by the law. Thank you. Next, Asia Pacific Beauty Group Limited, Ms. Anna Chan. Chairman, good morning. our company has been selling beauty products for 17 years. We agree that the public should be better protected. And so there should be a regulatory regime. By doing so, the professionalism and acceptability of our industry can be enhanced. However, at the same time, we have to consider the feasibilities of such measures in the market. We have to ensure that the future market would not only be monopolized by doctors. We have the following views concerning the consultation. First of all, for the working group, it has suggested that certain procedures will be classified as high-risk procedure. However, it has not looked at the interest of some other stakeholders. For example, we are providing a lot of skin improvement services in our industry, and for high-risk procedures, they are already carried out by trained people. But now in the suggestion is that these procedures can only be performed by doctors and dentists. In the past decades, these were classified as beauty services, and how come now they be regarded as medical procedures? And also, when it comes to the operation of beauty parlor nowadays, the operating cost has been increasing all the time, and we cannot just rely on old services. No, we have to invest a lot of money to buy advanced equipments. And these equipments are now classified as Category 2 or Category 3 procedures. In the future, when there's regulation, we have to hire medical professionals or doctors to perform these procedures. And if that is the case, our costs will surge. Our industry has been providing services to customers. We just want to provide beauty services. However, in the past 2 years, we have seen untoward incidents. So that's why now the blame is put on us. And we think the relevant doctor should be held responsible, but not the whole industry. And also, when we look at the present number of doctors in Hong Kong, we know that it is far from adequate. However, in the past, our industry has been operating many of these machines and equipments. In the future, if these equipments are to be operated by doctors, then there may not be enough people to do that. I think we can train our staff, and they can receive more education in this area, then they can operate these machines in the future, and the public's interest can be safeguarded. Next, Hong Kong Association of Cosmetic Practice, Dr. Ringo Lam. Good morning. I speak on behalf of the Hong Kong Association of Cosmetic Practice. Now, we are an association of registered doctors in Hong Kong, and they work in the private clinics. So this time around, the proposed regulation of private healthcare facilities is actually the regulation of us. We also perform surgical and non-surgical procedures. So I would like to talk about 5 points. First of all, our association supports the government's proposed regulation because it can safeguard the health of Hong Kong people. This is point number 1. And point number 2, well, for the consultation document, we find that in both the English and Chinese versions, they have adopted an across-the-board approach to define high-risk medical procedure. In the consultation document, we discovered that some of the high-risk procedures are not regarded as high-risk in international standards, and vice versa. So I think there are discrepancies. We are very worried about the discrepancies because Hong Kong people may not be protected sufficiently. And also, after reading the consultation documents, we also discover some problems. For our members who are doctors, they will be working in the clinics and they may be providing cosmetic services, but they cannot carry out operations in their clinics anymore. They have to go to the operation theaters in private hospitals. These may create problems because the demand will be much greater than the supply. So we are very worried about this point. And fourthly, for the consultation documents proposed regulation, it may result in a very long waiting time for private hospitals, operation theaters, and the price may even shoot up. So Hong Kong people may go to Korea, Taiwan, Japan for their cosmetic operations. So in the future, the number of untoward incidents may drop in Hong Kong, but actually these incidents are happening overseas. Is it something that we want to see? And point number 4, our association has looked at the consultation documents, page 84, chapter 10. Chairman, please allow me to make my last point. It's talking about a regulatory authority, and there will be an advisory committee. And this advisory committee is on defining high-risk medical procedures. It will cover Hong Kong AM and some professional organizations. They will be the members of this advisory committee on defining high-risk medical procedures. We hope that we can also be regarded as one of the professional organizations and join this advisory committee, because all our members are full-time practitioners, and we provide beauty services. In this regard, every day we are very familiar with the scene. We know what kind of procedures are most popular in Hong Kong, and some of these procedures may be very risky. So we hope that we can provide our knowledge to the advisory committee, and the governments can form policies before any medical incident happens. This is the most important point. Prevention is better than cure. The prevention of medical incidents is very important for our association. This is all I want to say. I'm sorry I have spent an extra 1 minute 40 seconds. Next, Federation of Beauty Industry, Ms. Chiu. Well, we have submitted a detailed report in writing to you. That's about our views, but I would like to highlight several points. First of all, about the definition of private healthcare facility. In the consultation paper, high-risk medical procedures are mentioned. However, some of the contents are very ambiguous. For example, tissue filling, are they equivalent to hypodermal procedure, etc. There are a number of procedures that are named in your consultation documents. Are these procedures the same as the procedures we are administering, but with a different name? We need clearer wording. Otherwise, the stakeholders would not know whether the procedures they are performing will be regulated in the future, and they cannot express their views properly concerning the consultation documents. As for the scope of regulation, in the document it is said that private healthcare facility will have to hire a professional person to head the facility. So what kind of person he should be? Should he be a nurse, a doctor, senior person from the healthcare profession, etc.? We want to know more about this. And also point number 3, when it comes to the regulatory authority, we want to know more about it. We agree that the regulatory authority should be authorized to do the regulation. And we have different views concerning this when we formed the working group on differentiation between medical procedures and beauty services. And 15 procedures were agreed by the working group that they should be performed by doctors. We are afraid that the regulatory authority will be given too much power. Otherwise, the healthy development of our industry may be hampered. We are also very concerned about our future development. And there are a lot of things in the consultation documents which are still under study. We are particularly concerned about the regulation of medical equipment. When the government regulates, we are afraid that some beauty equipments will be classified as medical equipments, and they have to be operated by doctors. This will affect the livelihood of many beauticians. So after looking at the consultation paper, we agree that a good regulatory regime can help protect Hong Kong people. However, as an industry, we are also very, very worried. That is, our normal operation and business environment will be affected. We hope that the government will listen to our views, and I hope you can respect the sustainable development of our industry. Next, Ms. Phoebe Ma, Hong Kong Qualified Standard Beauty Association. Ms. Ma, can you speak into the microphone, please? Because of the DL incident and the reform liposuction incident, and also because of other medical incidents that we've heard of, now the government is proposing to regulate private healthcare facilities. Our association totally supports that. Members of our association are stakeholders of the beauty services industry. Now, this is a very old industry. We have had a long history. As for medical beauty services, they have been popular for a dozen years or so. People may think this is a new industry. Our association thinks that investigations should be properly conducted into the untoward medical incidents that we mentioned earlier, and all the gray areas in our industry should be clarified so that in the future we can suit the remedy to the case. Thank you. Next, Mr. Alan Fong, Association of Doctors in Aesthetic Medicine, Hong Kong Limited.
Mr. Chairman, I'm the chairman of the Association of Doctors in Aesthetic Medicine, Hong Kong Limited. I'm Dr. Fong. At the moment, we have 120 members who are involved in aesthetic medicine. So we'll only talk about aesthetic medicine today, not other issues. So we must differentiate between beauty procedures and medical procedures. Below the superficial tissue of the skin, we should deem the procedures medical procedures. Injection, equipment, skin replacement, etc. should be carried out by registered doctors. And in future, there should also be regulation of private institutions as well. Besides, we support the recommendation that a regulatory authority be set up to regulate the use of high-risk equipment. There may be a lot of side effects, and high-energy equipment may cause risks not just to the skin but to the eyes and even to the operators. If the operators are not trained, it may be very risky, and only registered doctors will be held liable for compensation. If anybody can carry out the procedures, if anything happens, he or she will only abscond, not compensating the patient. And for definitions, tissues can be used for filling or any filling tissue. But when I look at these two definitions, I think that in most cases it will be using tissues for filling. I think a more detailed definition is necessary. Beauty services is an emerging industry. Not even the academy has the discipline. So in future, there must be a professional medical body to carry out coordination. May I add this? Earlier, the Department of Health published a book on medical beauty services or aesthetic medicine. Apart from, well, the contents are very good, but apart from asking for the name of the doctor, the consumer should also ask whether or not the doctor has taken out medical assurance, which is rather expensive. So it's only with quite a volume of business that he can afford the insurance. Next, Ms. Teresa Choi Zhang Yuk Ling, Hong Kong Association of Professional Aestheticians International. Mr. Chairman, sustainable or continuing education is our main task. The beauty services industry has been in existence for quite some time, with 60 to 70,000 workers. Now, all these years, they cannot work in a stable manner because they have to worry about their livelihood. So I think you should be concerned about the livelihood of these workers. Dr. Joseph Lee and your colleagues, you should address our various aspirations. Well, our industry does not mind regulation. In fact, we welcome it. But we would like to be treated fairly and justly. And for each regulated procedure, there should be clear guidelines. For example, for risks, all procedures will consume money on the part of the consumers, and eventually the professionals may be affected. Besides, we heard that the government would commission overseas experts to work out the guidelines for the equipment. So we're worried that laymen may be regulating professionals. Stakeholders and consumers may not be protected thus. Besides, the beauty services industry is an industry with economic benefits. It also provides potential opportunities for our young people. So the government should educate young people such that they can join our industry. That will be a positive approach, and we can create new trends in the beauty services industry internationally. Finally, a consultative committee should be set up comprising different representatives from different sectors of the beauty services industry. And you should finalize your recommendations only after consulting the consultative committee. And then for statutory recognition, we want, apart from accreditation, enhancement of public safety. Next, Democratic Party, Ms. Josephine Chan. Well, I'm the convener of Healthcare Group. I'm Josephine Chan. The regulation regime should cover private hospitals, daycare, healthcare institutions that carry out such procedures, and corporations or groups of companies that provide this service. Now, in Chapter 4 of the Consultation Document, 4 regulatory categories are mapped out. Some only apply to private hospitals, but not ambulatory care institutions and groups. Quotations, price quotations, electronic records, exchange and accreditation. private institutions should also be regulated in the next stage. They shouldn't be classified as non-applicable or not applicable. Otherwise, these private institutions will be just like outsiders. Chapter 5 of the document is very important. It's about corporate governance. However, in the document, it is recommended that medical and healthcare institutions should set up internally regulatory setups for governance, etc. That's not enough. Not enough protection is offered to the consumers. So the DPS of the view that private medical and healthcare institutions should have representatives of patients and consumers to take part in this governance monitoring. Besides, a public complaints committee should also be set up. It's also recommended in the document that a list of prices and quotations as well as recognized packages should be published. We're worried that can this interface with the other consultation document on voluntary healthcare insurance? In future, when we have statutory voluntary healthcare service, healthcare insurance, will packages not be asking consumers to pay more? Take, for example, 20%. So for fee regulation proposed for private institutions in this document, we don't think that's enough. Well, today we don't have enough time to go through all our views, and we'll cover all of them in our written submission. Thank you. Next, Ms. Yang of Beauty Industry Reform Research and Development Committee. Thank you. Our members are professionals who have worked in the industry for a very long time, and we understand that the recommendations will help with protecting consumers' rights. But the recommendations are not fair enough. In the whole document, not much is mentioned about beauty services procedures. Without due consultation with consumers and the beauty services sector, 15 procedures will only be carried out by doctors, and for the remaining 20 procedures, they're put under the regulatory regime for medical and healthcare equipment. We don't agree with that approach. In fact, consumers' requirement for quality services are ever enhancing. The document does not define premises for high-risk equipment. Will they be regulated under the regulatory regime? Our industry is deeply worried that if in future high-tech equipment used by the beauty services industry may be considered as medical and healthcare equipment and be regulated. Well, this is detached from the actual operation of the industry, and this will deal a huge blow to our industry and affect the freedom of consumers. So studies should be conducted on high-tech equipment, and industry members should be consulted. The content of consultation and study are not known to the industry. So in future, more beauty services may be defined as high-risk medical and healthcare procedures. So many of our beauty services may have to take out a license. We urge the administration to set up a steering committee on beauty services. In fact, for all these years, the government has turned a deaf ear to our requests and aspirations. We're passively waiting for your responses. Even though you bring in international experts, they may not understand the need and demand of the local beauty services. So please listen to our views and discuss with us and join hands with us to work out a plan that can protect consumer safety as well as a professional regulatory regime. Next, Hong Kong Beauty Press Limited, Mr. Ip. Thank you, Mr. Chairman. The theme of this consultation exercise is private healthcare facilities. Apparently, beauty services are not very much affected, but in fact, the recommendations will have far-reaching implications on beauty services because there will be relevant legislation on the regulation of beauty services. In many incidents, the consumer suffered from procedures, and very often these procedures are carried out by doctors. Now, the proposal is for a regulatory regime to be set up. Well, the motive is not incorrect, but the approach is problematic. Just think about the affected. They did not contract diseases or sustained injuries. Why did they seek help from these institutions? How did they obtain their service information? How did they purchase their services? And in Hong Kong, do we have training for such cosmetic services, beauty services? So can this document solve all these problems? If not, the beauty services will be sacrificed and small enterprises may also be sacrificed. The ultimate beneficiary won't be the consumers and the public. It will only be a major transfer of benefits. Please face squarely this objective fact that beauty services do exist, and this industry brings in economic benefits, say up to $10 billion or tens of billions of dollars. This happens overseas, from training to service introduction, sales, and implementation. We must have systematic regulation. Don't think that regulation won't affect beauty services, because non-treatment services, if they're classified as medical and healthcare services, be it high risk or low risk, they'll be forever separated from the beauty services. We have to enhance the standard and safety of beauty services, so the standard and quality of the personnel involved should also be enhanced. We should not just separate those services and pass them to the doctors who are actually doing life-saving work. That's not to the interest or in the interest of the public. When certain services are classified as medical procedures, so why should we care about the equipment used? In the document, it says that most beauty services procedures use medical equipment. Without a consultation and report, why should you be saying so? So you have a preempted position. I think you don't need the support of the beauty services for the establishment of the Innovation and Technology Bureau.
Next, Ms. Ma, Hong Kong Beauty Management and Development Association. Good morning. Now, because of the DL incidents and because people have died, now people are very concerned about our industry. However, they do not have a thorough understanding of the beauty services industry. There have been a lot of negative criticisms. We hope that the government will look at the situation closely and be more target specific. We hope the government will clearly delineate beauty services and medical procedures. We hope to see clearer guidelines. With the advancement of technology, we are also using some new equipment. We are using advanced technology. And also for beauticians, they have been taking training courses. They have been getting new certificates so that they can provide better services to our customers. It is impossible for our industry to remain at the status quo. We will be using new technology. So we hope that there can be examination system. So after taking the examinations, if we pass, then we will be qualified to use new equipment. Of course, safety is very important. The government should classify medical procedures and beauty procedures clearly. Now, by doing so, we can ensure the rights and safety of consumers. We hope that the government can help our industry so that there can be central certification, accreditation, and regulation. And then our industry would be more, we gain more recognition. And also a steering committee should be set up so as to help the long-term development of our industry. We aim to provide higher quality beauty services to consumers. The beauty industry is one of Hong Kong's industries. The government should support our industry because we employ about 100,000 people. There should be room for us to develop, and our aspirations should be heard. We hope that we can compete on a level playing field, and our survival space should not be stifled. Next, Hong Kong Private Hospitals Association, Dr. William Ho. Thank you, Chairman. The Hong Kong Private Hospitals Association supports and welcomes the government's consultation document. We think that for the private healthcare market, this document will even help them develop more healthily. We have provided a detailed submission, and I would like to highlight several points. Some people have talked about ambulatory facilities, and now there are more and more of them. They are performing medical procedures, and many of these procedures are high risk. They are not that different from those procedures performed in hospitals. Now, in terms of competition, this is something good. However, when it comes to regulation, we should use the same standards. In the consultation paper, several points have been suggested, and we are very concerned about this. For example, the qualification of doctors, clinical audit, reports of sentinel events, etc. For doctors, we have to ensure that they have received enough training before they are allowed to perform high-risk medical procedures. And if such procedures are performed at other places without such control, we are very concerned. As for clinical quality, Dr. Yong also mentioned this point. We should encourage doctors to take part in the discussion of sentinel events so that we can learn from such events. However, for private hospitals, the doctors are not employees of hospitals, so it's very difficult to encourage them to take part in such discussions. So we have to ensure that the sentinel events information can be disclosed to everyone. And also for price transparency, we support it, and we support the spirit. When it comes to actual implementation, in the consultation paper, it is suggested that quotation forms should be provided, but we don't think that is very feasible. Because most doctors are not our employees, and different doctors may work in a different manner. In particular, for the materials they use, or the operation time, the days of patients hospitalized, etc., there are a lot of differences among different doctors. If you ask for a quotation, it's very difficult. Now, some hospitals can provide you with historical statistics. That is, other than getting a quotation from the doctor, the patient may roughly know what will be charged in total by the hospital. But it's very difficult for the hospitals to know exactly how much the doctor will charge eventually. Thank you. Next, Consumer Council, Ms. Tracy Chu. Good morning, everyone. The Consumer Council would like to express its views on the consultation paper. We understand that 3 types of facilities will be regulated by the government. We hope that the definitions can be clearer so that we can advance with the times. And this Consumer Council supports that support the proposal that there should be a person responsible for all these healthcare, private healthcare facilities. And if unsuitable people are employed or unsuitable procedures are performed, this person should be held responsible, and there should be a two-tier complaint system. We think that for the independent complaints committee, representatives of the private sector should also take part. With regard to the sentinel events, we think that when high-risk procedures are performed in ambulatory setting, if anything untoward happens, reports must be made immediately. We also support price transparency. We think that we should implement measures to monitor price increases in private hospitals. As for packages, there are common operations in private hospitals. We think that private hospitals should provide packaged prices, and also timetable should be set out for such kind of procedures. Penalties and sanctions. Now, for some procedures in private hospitals, they may also be risky and life-threatening, so sanctions should be heavier. It should be linked to the level of risk. So we think that different levels of risk should result in different level of penalties. And there should also be a review of the present regulatory regime of private healthcare facilities. No matter whether we will have medical insurance in the future, the government should set up a system to regulate private healthcare facilities. We hope that this can be implemented as early as possible. Next, International Seeker Association of Aesthetics. Good morning. Ms. Shelley Look. We have a history of 34 years. All our members are professional beauticians. They have international qualifications, and they would continue with their professional studies. However, we are very concerned about the present situation in our market. There are already working groups trying to regulate us. We think that medical procedures and beauty services should be differentiated very clearly. Many people mix up beauty procedures and beauty services. Most of our members think that the government should give people a clearer picture as to what medical procedures are and beauty services are. Next, the Society of Hospital Pharmacists of Hong Kong, Mr. William Choi. Thank you, Chairman. Dr. Koh, good morning. We support the proposed regulation of private healthcare facilities, including hospitals, facilities providing high-risk medical procedures in ambulatory setting, and facilities providing medical services under the management of incorporated bodies. And 19 aspects, 5 categories will be regulated. We think that the public can be protected in this way. We think that an electronic medical record should also be extended to these facilities. We think that the patient's interest should override everything. But when medical incidents happen or taxation disputes happen, the e-records are the most important information. This is of utmost importance for protecting the interests of the people. We hope the government can give us a timetable so that we can prepare accordingly. The government should show us that it's determined to protect the health and safety of people. And also pricing transparency should be enhanced. Now, this will also be conducive for the implementation of voluntary medical insurance policies. Now, the pricing strategy and scheme is not transparent. Consumers' right to know is undermined. And also with regard to Annex B, it says that for chemotherapy and their drugs, most of the medicine used are carcinogenic. So we hope that regulations should also be in place in this regard so that medical professionals, people in the vicinity, and patients can be protected. Chemotherapy medicine should be placed in a safe area, and there should be adequate ventilation facilities, because if the molecules of such medicine are light, they may enter the central air conditioning system. So we suggest that the government make amendments to this area. And also the EPD should look at the ventilation. Otherwise, the carcinogenic agents may spread to buildings in the vicinity, because at present the situation is far from ideal, and people in the surrounding buildings may be affected. Next, International Beauty Professionals Validation Association Limited, Ms. Mandy Ju. Thank you. I speak on behalf of the International Beauty Professionals Validation Association Limited. As for regulation of private healthcare facilities, not all of the consultation documents is about the beauty industry. However, we still have the following points to make. Now, we object to an across-the-board measure. We do not think that the government should regulate us as if we are all performing high-risk medical procedures. Our petitions are certificated, and our members are working in beauty parlors, and they are also selling beauty products. They are very qualified to do what they're doing now. And for our industry, we have always been abiding by the law, and we are self-disciplined.
And we put public safety at the top of our priorities. Our beauticians have always been advancing with time, and throughout we've always added value to ourselves. So we do not resist accreditation as well as related measures. At the same time, the government must listen to public views in a broad manner and take care of the interest of the whole industry. Some of us have been working very hard and honestly throughout these years. Finally, we do want high value added and continuous advancement. But if you lay down too stringent standards, our industry may be affected. We don't want to benefit our counterparts in other jurisdictions while we suffer. So please treat us fairly and justly. The beauty industry is entering a new era, and we're continuously accepting new technology. If we don't do so, the beauty services industry of Hong Kong will only regress day after day, leading to a great deal of unemployment. Thank you very much. Next, Liberal Party, Mr. Xu. Thank you, Mr. Chairman. To enhance public health and people's livelihood is, of course, a good thing. So basically, we support the proposals in the document, in particular for the private sector, for private hospitals, if they can enhance the transparency of their fee structure, it would benefit the public more. As regards premises with medical equipment is of course a good thing to enhance the standard and protect the public. Yet, very often, in such exercises, the government's proposals may conflict with the interest of the industries concerned. Here, the beauty services industry is airing their grievances. Prima facie, this document is about regulation of private healthcare facilities. But we all know why this document came about. It's because of the spate of incidents. The beauty services industry has been developing very rapidly. In Korea and Taiwan, this is the major industry. In Hong Kong, we always talk about industrial transformation, etc., etc. Precisely, this is the industry that you should think of. It involves tens of thousands of employees. So how should you go about it? You know that this fierce competition in the industry. For example, you mentioned regulation of equipment. Honestly speaking, if you let the doctors do all the things, just think about the queue for public hospital services and the queue in the public sector. So eventually all businesses will go to the doctors. But honestly speaking, the doctors won't be able to cope. They can't swallow, so to speak, all the businesses pass to them. So I think you should do accreditation for the beauty services industry. Let me cite this as an example. I patronized a dentist. In the past, I got the dentist plus 2 nurses. But last time, I only got 1 teeth carer. Well, that carer did his work very well. So you have to differentiate very clearly the medical profession and the beauty services industry. Otherwise, the latter will wither and the benefits will vanish. Thank you. We have almost 27 deputations today. They've all spoken. Thank you very much. Secretary for Food and Health, do you have anything in response? Dr. Koh? Mr. Chairman, I won't comment on the individual comments of the individual deputations and individuals. But I'll choose a number of areas on which quite many deputations have spoken on. First of all, defining risky medical procedures and beauty procedures. Well, in fact, as one of the deputations said, there's already a clear definition to regulate the procedures carried out by private healthcare facilities, which are of high risk, which not. We make it very clear in the consultation document that the degree of anesthetics, the procedures to be adopted, as well as the risk undergone by the patient will be considered. Science and technology are ever advancing, even for medical services. So it is impossible for us to write all high-risk procedures into the law and for those procedures to remain unchanged forever. So we usually adopt a more flexible approach. That is to use a schedule to list out the high-risk procedures. Now, who are to do the definition? We must have an expert panel or a consultants panel to do the job. I won't name names today, but when we enact the piece of legislation or a piece of subsidiary legislation, then we'll work out the schedule. But today I won't comment. The most important point is that we should set up such a mechanism. So the first step to take is to pass a law. Without a law, you won't be able to set up the regulatory regime, and you won't be able to continuously update the list. There's this comment about laboratories, whether or not they need to be regulated. Now, this issue is not covered by this exercise on private healthcare facilities. In fact, laboratories are already regulated by law. Technically, at this stage, it will be rather difficult to cover laboratories as well in one piece of legislation. So if you want enhanced regulation for laboratories, probably we have to have a separate exercise and a separate piece of legislation. As for comments asking for higher degree of transparency in fees and charges, I earlier explained to private hospitals that for those doctors who are not employed by private hospitals, the hospital concerned should compile a budget for the patient, and the private doctor should also do so. Finally, many friends raised the concern about the motive behind this exercise. Yes, the background is that in recent years we had a spate of incidents involving beauty services. Well, undeniably, that is one of the factors. But for the regulation of private healthcare facilities, it is one of the major tasks in the portfolio of the Food and Health Bureau. But of course, the spate of incidents forms part of the background. The existing regulatory regime for private hospitals has not advanced with time because the principal ordinance was enacted decades ago. In the audit's report, governance of private hospitals was mentioned, so we have to enhance regulation in that regard. Moreover, more and more high-risk procedures which were conducted formerly in hospitals are now conducted in non-hospital private institutions. Therefore, we have to regulate high-risk procedures. So that's our main objective. In the regulatory process, undeniably, registered doctors will be involved. And under registered doctors, we have specialists as well as general practitioners who may also conduct beauty procedures. And sometimes when a consumer goes for beauty procedures, it may not be because that consumer is suffering from a disease. But we cannot say that when the consumer is not suffering from a disease, then when he or she goes for such beauty procedures, we need not have regulation. We must not say that. Doctors must always have one point of consideration. Whether is a pathological concern or a case in which the physical and mental state of the patients need be considered, explanation should be offered to that consumer as to whether or not a risk-involved medical procedure should be conducted. I think that's the responsibility of the doctor. One of the friends here just said that we should consider the industry, balance of supply and demand, livelihood, consumers' rights, and so forth. I admit that in this exercise, both the government and the LegCo should consider all those aspects. But the most important consideration, above all, is that when a consumer or a member of the public undergoes such procedures, safety is the first and foremost concern. Mr. Albert Ho would like to ask questions. 5 minutes each as a start. Mr. Albert Ho, I'd like to thank the deputations for coming today to offer their invaluable comments to us. For private hospitals and private healthcare facilities, they belong to two different categories, but they should come under regulation. Today, most deputations are on beauty services. So I'll speak on the regulation of beauty services first. Many friends here are worried that the proposed regulation may affect the development of the beauty services as well as the livelihood of the employees. I understand that worry. I heard this comment that we should not view the issue from the standpoint of the medical profession and treat beauty services as an industry, because members of the industry are also professionally trained. Well, I think Mr. Ip made that point very clear. Mr. Ip from Hong Kong Beauty Press Limited. Now let me ask this. The industry is developing in a free market. If you don't want regulation, do we mean we shouldn't regulate the industry at all? No, we have principles underlying consumers' rights, and society has a lot of requirements and expectations. Yes, I understand that unless it is really necessary, we shouldn't regulate an industry by law. But the fact is that some incidents had occurred. In those incidents, invasive procedures had affected people's safety, when some incidents also occurred in Korea. So, regulation and intervention must be reasonable and necessary.
Dr. Lam has shared his experiences with us. He says that certain regulatory measures are reasonable, and we should attach importance to your views. I really support that members from your association should be sitting on the future committee. So if we do not look at things from a professional point of view or from the public's point of view, then how should we look at it? Shouldn't the government help to train up more people? Shouldn't the government implement policies to support the development of industry? We may not be discussing those today. Today we are focusing on the well-being of citizens. So now we are looking at medical procedures. And when regulation is called for, we should do it. Now, should we be regulating certain procedures or certain equipments? I think we should look further into it. Some of the deputation said that for some equipments, they can be used by ordinary people who have received relevant trainings. It's not necessary that they are used all the time by doctors. However, if we do not look at things from a medical point of view, how else should we look at it? Are we merely looking at it as a beauty services industry? If we just look at it that way, how can we conduct regulation? Mr. Yip. Thank you, Mr. Ho. Thank you, Chairman. I agree with Mr. Ho, but I would like to clarify a point. When it comes to the development of our industry, the health of people, and regulation, I don't think they contradict each other. They can happen at the same time. No matter how a service is defined, the most important thing is the patient's safety or the consumer's safety. Now, if you just look at things from a medical point of view, it's not a comprehensive view, and the regulation would not be focused. We have a huge industry, and it covers different trades. We have beauticians, we have doctors. Some doctors just told you that they are engaged in beauty services on a long-term basis. So the nature is very important. Now, these consumers are not sick. They are not patients. The most important thing is how they find such beauty services. They are not looking for a treatment, so that's why they would not be discovered in the medical system. So where do they get information? If they want to beautify themselves, where do they get information? I think these has to be regulated. And planning is very important. If you do not have a very good planning, how can you regulate? The Health Services Panel has proposed the establishment of a steering committee on regulating the beauty services industry. But it's not followed up. I agree with the member. These have to be discussed, but the present steering committee on review of regulation of private healthcare facilities do not have our members sitting on it. Our views are not respected. We are all talking about beauty services. Now, why do you want to set up a steering committee so fast? It was because of the several sentinel events. Yes, Dr. Koh, I understand that you have been talking about regulating private healthcare facilities for a long time, but this time around, I don't think you are focusing on the problems. Dr. Lam? On behalf of our association, I would like to supplement a few points. When it comes to regulating doctors in Hong Kong, there is a very comprehensive system. We have the Medical Council, and we have CAP 141, regulating the professional ethics of doctors and also medical treatments. It's not doubtful that the standards are very high. However, for beauty procedures, they are advancing all the time. There are new equipments and technologies every several months. It may start in the US and then spread to Europe and Asia. And how do we do the gatekeeping now? I think now we just adhere to our professionalism. Now, there may be 100 new medical procedures or equipments or surgeries, and we would not accept them 100% and perform them immediately on our customers in Hong Kong. We are frontline doctors. We are trying our best to be gatekeepers. We want to safeguard the health of Hong Kong people. And we are doing this already. However, at the same time, there is no channel for our association We are doctors providing beauty services. In Hong Kong, we have at least 200 doctors that are in this area, and they are not surgeons, and about 100 other doctors are engaged in high-risk medical procedures. Now, if more channels can be created so that we can cooperate with the governments, then we can provide more up-to-date information to the government. We have the confidence that similar medical incidents, such as the DL event, will not happen again. Because we can see the risk in new procedures. However, we are only working in our clinics and our private health care facilities. We can bar such risky medical procedures from our clinics, but we want to share with the doctors of disciplines under the Hong Kong Academy of Medicine. But at the moment, we do not have the channel. Now Hong Kong AM was formulate its own policy. But for these people who formulate the policies, they are not frontline practitioners like us. So I hope that an independent committee can be set up. Of course, it will comprise Hong Kong Academy of Medicine representatives and full-time frontline practitioners like us. By then, we can complement each other and we can give each other mutual support. This can prevent the recurrence of untoward medical incidents. This is what our association thinks. Prevention is better than cure. We must prevent further occurrence of medical incidents. And that's why today we are here expressing our views on regulation of private healthcare facilities. At the moment, we do not have any channel to have formal meetings with the Hong Kong AM. Well, after listening to Dr. Lam, I want to talk to the secretary. Yes, these doctors are doing work at the front line every day. I hope that you can invite them to sit on your committee. Secretary, please listen to more views, because they do this on a daily basis. And second, just now Mr. Ip also spoke on behalf of his industry. He says there's a communication problem when it comes to the development of their industry. They do not object to the proposed regulation of medical procedures because they also want to safeguard the health of people. However, they think some proposed measures are excessive. So can you communicate more with them, Secretary? Mr. Ho, yes, I agree with your analysis. You said that if you look at this from the perspective of a citizen, how can you not look at it from a medical angle? Mr. Ip says that for some citizens, when they do this, it's not a medical treatment. They just want to be more beautiful, more good-looking. Let me cite an example. For example, injection of cell products into the body or liposuction. These are examples of high-risk medical procedures. And a member of the public is not sick when he wants to do this. He's not fallen ill. So quality assurance and risk assessments are very important. You also have to look at the possible complications. All these are medical issues. How can I not look at it from the medical perspective? This is Mr. Edward Ho's analysis. I think it's very reasonable. And second, Dr. Lam talked about representativeness and communication. I also see eye to eye with him. Dr. Lam has expressed his views, and he looks at things from a professional angle. He also thinks for the interest of the people and consumers. I agree with him. In the future, when it comes to consultation, a principle is very important, and there are two considerations. First, it must be professional, because we are talking about some very professional issues. And for our future committee, if you are sitting on the committee, you should not look at the interest of your own practice. The government relies on such committees to make professional decisions. So we are talking about science. We are not talking about interests. Now, this is all I want to say now. Professor Fernando Zhang. Thank you, Chairman. For the regulation of private healthcare facilities, of course, we support it. The law should be amended. In the 30s and in the 50s, we had this old pieces of legislation, so we must catch up with the time. And I would also like to thank the deputations for attending today's hearing. You represent different interests and angles. This is a complicated issue. Of course, we have private hospitals and private health medical groups and healthcare facilities. This regulation is relatively complicated. The Labour Party's stance is that we would look at things from the users and patients. Of course, for beauty services, the consumers may not be patients, but they choose to undergo certain procedures which may involve high risk, and such procedures may have to be carried out by medical professionals. In this regard, the protection in Hong Kong has not been strong, and according to the consultation document, our present regulation is outdated. As for the regulation of private healthcare facilities, I think we must look at the governance and price transparency of such institutions.
不過我聽到咧，即係
By and large, from what we heard, most views are in support of the recommendations. Beauty-based services may not be put under the regime of medical procedures. From the angle of the user, risk is most important. Whether or not the procedures involve a certain degree of risk to the patient. So, in our opinion, regulation is important. Otherwise, the patient may not be the patient, but the consumer may face risks. If we relax on risk management, the consumer's safety may be affected. So I'll continue to listen to your views. I hope that apart from your business, you should put safety first. As for handling of complaints, the recommendations in the document propose a three-tier system. Individual morality and individual conduct should be regulated for the doctors. At the moment, we do have some form of regulation. The electrical pass through motions to support an independent mechanism to handle complaints. Well, the medical council does have some powers, but there are defects. Some cases have been there for, say, 5 to 6 years without being handled, so they have a huge backlog. I did some calculation and arrived at the conclusion that around 6% of the complaints were handled. So we're talking about an institution, a regulatory institution. You propose a 2-tier system. The institution itself should handle the complaints first before going to the centralized body, centralized authority. You propose streamlining as well. Well, if we simplify the procedures, will we also at the same time reduce the effect of regulation? The Consumer Council is concerned about this. Sometimes penalty and consequences are not compatible with each other. Sometimes penalty is too light. So I'll continue to listen to you to see how we can enhance the protection for consumers or patients. Dr. Ko, Bureau Director, any response? I agree to the analysis of Dr. Cheung. In the process of consultation, I'll keep an open mind and listen to more views. Then we'll collate the views received and make a decision. Next, Dr. Chang Kwok Chi and Mr. Poon Siu Ping. Dr. Chang Kwok Chi? Sorry, Mr. Chang Kwok Chi. Mr. Chairman, of course, there are a lot of problems here. Many are related to the beauty services industry, so I'll comment mainly from that angle. Just now, Mr. Ip from the Hong Kong Beauty Press Limited said that we've not defined a lot of equipment yet, which are medical, which are for the beauty services. And then consumers, apart from going to doctors, may also go to the beauticians. So some equipment not necessarily used by doctors may not be used by beauticians either. Maybe somebody in the middle, that is the technician, is using the equipment. Now, you have a working group which I believe has discussed the issue. Well, understand that the name of the steering committee is Steering Committee on Review of Regulation of Private Healthcare Facilities. If it is a beauty company, so to speak, it may not be covered. But in that establishment, certain equipment and procedures may need to be regulated. And you said that you would consider this later. The Bureau Director said that we should do something fair and just to assist service users. If you say at the same time that if interests are involved, you will not handle those interests for the time being. But everybody speaks from the standpoint of his own interest. I don't have any conflict of interest here. Oh, maybe I have. I don't know whether or not I will approach one of these institutions one day. So the Bureau Director shouldn't close all the doors now. If you cannot handle all the issues mentioned by the industry just now, will you set up another steering committee to handle those issues? Bureau Director? Well, I'll handle Mr. Cheung's question from three aspects. Earlier, for procedures not involving high-tech equipment and high-energy equipment, we've actually separated them from this exercise. Of course, we cannot expect consensus among everybody. But basically, we're talking about regulation of equipment of an invasive nature. So one very important principle is the degree of intrusion. The higher the degree of intrusion, the higher the risk. For procedures with a certain degree of intrusion, we define them as medical procedures. They may not be performed by doctors or dentists, but they must be performed within the jurisdiction of a doctor or a dentist. It's just like injection. Very often it may not be the doctor carrying out the injection. It may be the nurse carrying out the injection, but the doctor is responsible. And then for high-energy equipment, I hope that those in the beauty services industry will understand that earlier, on optical or energy equipment, how should we draw the line? Which equipment should be responsible for by the doctor? So there exists this issue of interests. So different people have different views. We're not just talking about a person. If we only consider the composition of the steering committee, how many representatives from the medical profession, how many from the beauty services industry, well, if it is so simple, we would have made a decision much earlier. So we've taken out that issue from this exercise and have enlisted support from an international body to help us do the differentiation. So we don't count exactly how many representatives are from this industry, how many from that profession. It's not that easy and simple. Otherwise, I would have made a decision much earlier. So we would like to have more independence. So we have commissioned an international body to do the job for us. Yes, we do look at professionalism, but we don't just look at the number of representatives involved. Another aspect is of a higher level. Why do we... Well, this time we propose to regulate private healthcare facilities, but why the beauty services industry also feels that they're being covered is because some high-risk procedures may be involved. Take if I want to extract fats from my body, if I want to introduce certain cells into my body, then although the procedures themselves are not for treatment, as the procedures are up to such a professional level that complications may result, are there alternatives? Now, if these are not medical considerations, what are they? When it comes to fat extraction, if you don't want me to regulate you, it doesn't matter. But for a customer, if you think that he or she will benefit from fat extraction, then we have to perform regulation. Because to a certain extent, that's a surgery and that's a medical procedure. I hope nobody here will argue with me that fat extraction is a medical procedure. So assuming that nobody will argue that fat extraction is not a medical procedure, then if a certain person is of the view that fat extraction can assist this consumer in terms of beautification. And as this is a medical procedure, then there are two options. If you don't want to be regulated, you refer that person to a doctor. Or you just tell the customer that he should go to a doctor and let the doctor explain to him or her what risks are involved, whether or not he or she would have to face certain risks. So, you won't be regulated. And then, as far as the industry is concerned, there is this chain of interest. And if you want to benefit from the industry, then you will automatically be regulated by me. Assuming that you employ a doctor to perform the procedure, or in a certain corner of your beauty parlor, you will have a doctor perform the procedure, then you automatically come into my regulatory net. So that's out of your own choice, because a medical procedure is involved. In future, we'll definitely have a professional body, a group of consultants, to define whether or not a procedure is medical in nature. On this particular issue, we should not discuss whose interest is bigger or smaller. That group of professionals must start with public safety, even for beauticians and beauty parlors. But if you start with the interest of the industry, it's not acceptable for me. When it comes to a medical procedure, either you don't perform the procedure, or you advise the customer to seek help from a medical professional, or you come into my regulatory framework if you want to perform the procedure.
Mr. Pun Xiuping, thank you. The government has launched a consultation paper on voluntary medical insurance, and here is another document on regulation of private healthcare facilities. Now, the Medical Council and associations representatives have expressed their views this morning. They support price transparency because this is to protect the public's interests. Some may say that private hospitals now join hands. They are asking the doctors to take out unlimited liability insurance. Now, when the voluntary medical insurance is launched, healthcare prices may significantly go up. So, Secretary, what do you think? Well, Mr. Poon, for that insurance, it has nothing to do with our voluntary medical insurance. They are talking about doctors' professional liability insurance. So it has nothing to do with the public's voluntary medical insurance, and it has also nothing to do with the President's proposed regulation of private healthcare facilities. In this letter, they talked about transparency, and they say that they hope the government can put together policy so that price increases can be monitored. Otherwise, when there is a voluntary medical insurance, the private hospitals may raise their prices significantly. Yes, but for this particular point, it's right. Well, during our voluntary medical insurance consultations, many people have asked these questions. In the future, how can we prevent a sharp surge in medical expenses. At the moment, the government's policy is like this. For any private healthcare facilities, we would not monitor their prices at the moment. This is our principle. However, under this principle, we have to ensure that the fees and charges are transparent, because only by doing so can we safeguard the interests of patients and users. So in the future, when we regulate private healthcare facilities, we will empower the Department of Health, and it can instruct private hospitals to have measures in place. For example, for some common medical procedures designated by the Department of Health, the private healthcare facilities should publish their prices and statistics in the past. Then and consumers can make comparisons. For example, if he wants to go to a private hospital, and in the past that private hospital charged for a certain amount of money for this type of surgery. So with this kind of information in hand, he can ask the private hospital and the doctor about the fees that they are going to charge him, and then he can make a comparison. Of course, this is not the only measure. Just now I also mentioned that there should be a charging budget. Now, for medical services, they cannot give you a very detailed quotation. It's not like refurbishing your home, because you may have to buy different materials, and it is a service agreement. But for medical procedures, there may be unpredictable things. And if you are admitted urgently to a hospital, before you are admitted, you didn't even know you are ill. So how can people give you a quotation? So list of reference will be given to the patient so that the patient can make comparisons. If you have visited different doctors will give you their estimated budgets. Then you will have a clearer picture as to about how much you will be charged. And before you are admitted to a hospital, you can compare the prices of different doctors, and then you can make an informed decision. So we are trying to enhance the price transparency of private healthcare facilities. When there is transparency, there can be competition, and this may help suppress the price, which is likely to go up. Mr. Chang Kwok-chi, just now the Secretary answered my questions, and I find him very reasonable. Maybe I should ask Mr. Ip with the Secretary's remarks. Do you think his answer can solve your problem? The Medical Association asked the questions, not Mr. Ip. Well, Mr. Chang, sorry, let me interrupt. Mr. Chang Kwok-chi is asking about the interests of the industry and professional regulation. Now, let me look at it from another perspective. That is professional and semi-professional regulation. Just now you mentioned distinctions among different equipments, whether such equipments are operated by technicians, and whether enough consultation has been done. Mr. Ip. Thank you, Mr. Chang. I find it strange. We have been talking about this for a long time. It seems that our words have entered a deaf ear. We Well, for liposuctions, we are not saying that it is not a medical procedure. Well, our industry is not a new one. It's not unique to Hong Kong. It's everywhere in the world. And for our industry, there are different professionals. We have doctors, we have beauticians, we have Chinese medicine practitioners, etc. I am not saying that we want to classify certain medical procedures as beauty services, and we should not exclude doctors. Well, how can you assume that for procedures performed in the beauty industry, they must be unsafe? We need a platform for discussion. If you just talk with the medical professionals, our views are not reflected. Now, no matter whether a beautician or a doctor provides beauty services, they are both doing businesses. It's not just us that are doing business. Doctors would also charge their patients. So you think that we are just fighting for the interests of our industry? We ignore the safety of our consumers. No, we attach a lot of importance to the safety of our consumers because they are the source of our livelihood. And for DR, it's not that they are not paying for their mistake. They have collapsed. So I would like to follow up on another issue. Mr. Chang just asked a question and it was not answered. The HS panel has passed a motion that is a task force on the regulation of beauty services should be set up. We really want a platform for discussion. We are not saying that doctors should not be involved in our industry. We want to have a better scaffolding. We want to talk about different things, the introduction and promotion of services, the implementation of services, etc. Doctors can provide the services, but we do not want an across-the-board measure. We do not want to be mutually exclusive. But how do we put up this scaffolding? How do we ensure sustainable development of our industry? When you read the news, you can see that many mainlanders would go overseas for surgical, for cosmetic surgeries, for example, Korea, but a lot of problems happen. So if we can develop this industry well in Hong Kong, then we can also provide services to our motherland. We have a better legal system. Then why can't we have a good regulatory system so that we can make improvements? I hope that there can be a steering committee where we can share our views. I hope members can follow up on this. Yes, I share your views. I don't know whether it's under the jurisdiction of Dr. Koh or other secretaries. Just now, the secretary mentioned intrusive procedures, and maybe that would fall under your jurisdiction. And for many beauty procedures, I think they are intrusive. If you cannot answer my question today, it doesn't mean that you will not consider these in the future. Well, give us a direction so that the industry can be reassured. Yes, it cannot be addressed by the with the present mechanism, and you may not have enough manpower now, but please let us know the direction so that we know how long we will have to wait. I would like to remind members that today we are mainly talking about the regulation of private healthcare facilities, but there are a lot of ancillary problems concerning the beauty services industry. Yesterday at our regular meeting, because we didn't have enough time, we had to postpone an item. The Electoral Secretariat has compiled a very detailed report. It's on the beauty industry. It was supposed to be discussed at the HS panel yesterday, but now it's delayed, so we will discuss it in the year of the goat. Now, will this report give you answers? I do not know. However, the HS panel has been talking about this on a regular basis. I want to remind you that today we are not talking about the regulation of beauty services. We are talking about the regulation of private healthcare facilities. And for this consultation document, it may not have solved the problems concerning the regulation of beauty services. And for beauticians, are they regulated? Do they have a licensing system? And should they be also subject to the qualification framework, etc.? All these have to be discussed, but it's not what we are doing today. So let's go back to our focus. The Secretary will tell us later whether there is a direction. The electrical HS panel will be discussing about the regulation of the aesthetics industry. I think Mr. Siu of the Liberal Party wants to say something. I would like to respond to what Dr. Koh said. Now, today's topic is very clear. Now, if you are selling this regulation, nobody objects to it. We all support it. It is to safeguard the health of Hong Kong people. Nobody opposes it. And for liposuction is so bloody, beauticians dare not do it. But we are talking about some controversies. For example, radioactivity. What is meant by that? When I point a torch at my palm, you can see that my palm becomes reddish. Would that be invasive? Well, the industry is very worried about this. Dr. Koh says that he will be talking to professionals. I hope that you can really help the industry to address their concerns. Fortunately, I'm not in the beauty industry. Just now, Dr. Koh said that in the future you will be regulated by me. Then that really freaks me out. The Secretary is appointed by C.Y. Leung. C.Y. Leung elected by us. So that's now you're conducting a public consultation, and that's why I'm telling you what we think. I wonder if C.Y. Leung is elected by us. Secretary, first of all, for what the gentleman said just now about radioactivity, I'm not targeting you, but I don't want to confuse people. For radioactivity, it is definitely falls within the field of medicine. And just now we talked about some high energy equipment, so we will be discussing about them more later.
As for the regulatory regime, I already explained it. Well, we do not have any pretext to the effect that the beauty services industry is not safe. As the chairman said, here we're trying to regulate high-risk medical procedures for the sake of public safety. Whatever the objective of such a high-risk medical procedure, it remains a high-risk medical procedure. In the provision of that medical procedure, all those who are responsible should come under the proposed regulatory framework. In the process of the provision of a high-risk medical provision, if you have no involvement, then you won't be regulated. I'd also like to ask the Secretary a question. The industry raised an issue which the document does not mention, and you have not provided any explanation for ambulatory centers. Is it a health Is it a healthcare facility according to the definition? You mean the medical groups? Well, say you have cap 3 to 4 to regulate clinics. Say a few persons grouped together to open a clinic, to set up a clinic to provide, say, beauty services or whatnot. So is that clinic covered by this exercise? Well, there are 3 major categories under the document: private hospitals, ambulatory medical centers that perform medical procedures. We're talking about doctors. Of course, doctors can form themselves into a partnership. And then a limited company, that is an incorporated body that provides medical services. Then certain regulatory provisions may apply. Well, in the main, there must be a person in charge. Here we are worried that if it is a company, if you don't have a person in charge, that company may be disbanded, and if that is to happen, the person in charge will have to bear the liability, legal liability, under the regulatory regime. Dr. Fernando Chung? Oh, sorry, Mr. Chung Kwok-chi? Oh, he's away. Well, I believe the views of the industry are clear. Let me sum up. For the industry, in general, they're most concerned that when the definition for private health care facility is clear, they would like to know more about the steps involved. Will they be regulated or not regulated? So that's their concern. And different industry associations have said that they would like to know more details about different approaches like electronic health records. There's this concern about medical beauty services, which is not so relevant to this document. But I heard from the industry here that their major concern is that after the publication of this consultation document, medical beauty services or private beauty services may fall into the regulatory regime. I believe the Bureau Director has heard you, will pass your comments to the Bureau. Well, I mentioned something automatic. That is, you may automatically covered by the regulatory framework, but that doesn't mean that you're prohibited from carrying out those procedures. When we have a piece of legislation to regulate premises performing high-risk medical procedures, even if it is a beauty services company, if you are a doctor or if you employ a doctor to perform the procedures, it doesn't matter. You just follow the licensing regime. The licensing regime is not saying which companies can perform those procedures, which companies should not. You only need to satisfy the licensing conditions, which are objective. For example, how big the space should be, what equipment can be used, any code of safety, any requirements about training and qualifications, any risk management. If anything is to happen, do you have a contingency plan, etc., etc. So we're not excluding anybody. We're not saying that some people shouldn't perform the procedures. But if you want to perform the procedures, you take out a formal license. Mr. Chung Kwok-chi. Thank you, Chairman. I'd like to go back to the repeated mention about transparency in fee charging. Well, transparency is different from rationality or reasonableness. Well, you see, you got some statistics here about packages and so forth. But of course, these are just voluntary in nature. If the hospital or the center does not automatically inform the service users what fees and charges would be imposed, then it won't even work for the hospital or center either. So there's this other question of whether or not the fees and charges are reasonable. Can I ask Ms. Chu from the Consumer Council, what sort of fees and charges would you consider reasonable? And if a consumer considers the fees and charges not reasonable, apart from lodging a complaint with the Consumer Council, where else the consumer can go? Consumer Council? Are you in a position to answer this question? I know you're not the party fixing the fees and charges. I think Mr. Chung Kwok-chi was referring to a subjective feeling. Say, I feel the fees and charges are expensive. We're talking about value for money. Well, I pay this sum of money. Is the service worthwhile? This is different from whether or not I feel the fees and charges are too high. Well, some doctors' representatives were saying that they object to the recommendation on packages. Say, for appendicitis, if I charge you $5,000, I may be an expert. I may be a specialist in that regard. If I cut open your appendix and discover something else, I may need to perform something immediately. So we're not talking about beauty services. We're talking about medical regulation. Well, Bureau Director, don't get anxious. Wait. When there is a physiological change and you need to undergo a surgery, according to Dr. Ko, if it is a high-risk surgery, but that surgery is needed by you, it's not just about beautification or beauty services or cosmetic services. So this is something different from the concept of whether or not you feel that the fees and charges are too expensive, whether or not the services are value for money. Say, if I think I pay $5,000, I don't think that's worthwhile. The professional told me that I need to cut off my appendix, but after the appendix is cut out, it's discovered that there's nothing in it, nothing problematic. Or say I am told that 10 pounds of water has been extracted from me, but whether or not it's really 10 pounds is another problem. Ms. Chi? Well, pricing is precisely our concern. At the same time, we have the consultation document on voluntary healthcare insurance. Now later, when we have a voluntary healthcare insurance scheme, will doctors' fees and charges rise tremendously? That's precisely our concern. So is it possible to have a mechanism to inspect fees and charges as well as price adjustments? Dr. Ko? Now, first of all, many people here are worried that after the launching of the voluntary healthcare insurance scheme, fees and charges may rise. I understand that concern. At the moment, private hospitals don't have enough beds. If we create more demands, that worry is justified. But please do not forget that we did point out that at the moment, through various avenues, we've asked private hospitals and new private hospitals to provide more beds. According to Bureau's forecast, by 2020, if voluntary healthcare insurance scheme is implemented, the capacity of private hospitals can be increased by 40%. Then the pressure for higher fees and charges may be reduced. I also mentioned initiatives to enhance transparency. As regards how to judge the reasonableness of the fees and charges, there's no definition as to what complaints should be accepted and what shouldn't. Well, if a patient, after patronizing a private hospital, lodges a complaint with the hospital itself, failing that, if the patient complains to us, we have never said that a patient shouldn't complain about fees and charges. So we can also accept complaints about fees and charges. Number one, before receiving the service, does the user of service roughly know how much he'll be charged? I use the word roughly because, as I explained just now, there are bound to be uncertainties before the service is provided. So before receiving the service, the user of the service roughly knows the fees and charges. And the doctor is also described to the user what roughly will happen. Then there's no question of whether or not the fees and charges are reasonable. Say, if the user is told that a surgery will be performed and the surgery is actually performed. Now, that surgery is the user's choice. But in another scenario, you claim that you are going to provide a service, but eventually you collect the fee, but the service is not provided. Then, of course, we cannot allow that to happen. Now, this is different from the scenario of the patient, after being discharged, consider the fees and charges too high. We have to examine whether or not there are unforeseeable factors. Do we have standards and principles? Yes, we do. The only thing that we do not have certainty is that if the doctor really performs the surgery and before the surgery the doctor already tells the patient that he will charge that fee, then it will be very difficult for me to say whether or not that surgery should cost $100,000, $50,000, or $200,000, or $150,000. So the patient voluntarily receives the surgery, the service from the doctor, and the doctor does provide the service. Mr. Cheung Kwok-chi, is really a very difficult issue. That is, so long as the fees are known beforehand, it will be all right. It's just like oil prices. Why oil prices are so expensive at each and every petrol filling station, even though there may be a difference of 20 cents or 30 cents.
So I think the secretary can go back and think about it for some more time. If there are no other questions, then I would like to thank the deputations for attending. Dr. Lam, I would like to add one more word. It's about our association. Well, this is the first time that I attend a electrical meeting. Maybe my style is different from your standard style. I'm sorry about that. I've heard the deputations expressing their views. If all the organizations think about this, that is, if you have a close friend or a family member in the hospital and he's hospitalized because of a medical incident, is your family member, is a close friend of yours, please think about this scenario. And if you come back to this meeting after such an experience, would you have different views? Meetings, consultations, meetings, the eventual, the ultimate goal we are after is to protect Hong Kong people. How do we know that there will not be another Sentinel event tomorrow? We have been sitting here for hours. If we can come up with policies that prevent another medical incident, wouldn't we all be very happy? Not only doctors can save the lives of people, policymakers can even do more. So when we formulate our policies, if we factor this consideration in, then we can join hands to come up with policies efficiently. Now, there may be long-term policies, but in the short run and medium run, we can come up with practical and feasible practices. Then in 2015, 16, 17, we will not see another medical incident. I think that should be the direction of our meeting. We shouldn't be only looking at our own benefits, protecting our own interests. We should think that one day maybe your family member would visit a beauty parlor and he or she would undergo a medical procedure. If anything untoward happens to him or her, how can you bear it? If you think things like this, then we will come up with something practical very soon. And that will benefit all of Hong Kong people. Yes, thank you, Dr. Lam. As to what will happen tomorrow, we do not know, but tomorrow is the Chinese New Year's Eve, and you will have family reunions. Today, I think in Chinese customs, we are supposed to thank the God of the kitchen. Yes, we've had a lot of views, and for public hearings and LegCo, we have the responsibility to provide a platform for the public to express their views. So you are responsible for what you say. You have your ideal. We are all ears. And as to whether that will lead to changes, let us hope that things will be better in the year of the goat. Thank you.